Hello and welcome to the Illumia MD Online Training Academy. My name is Victoria. I'm a clinical educator for Illumia MD, and in this micro-teach we'll be exploring the concept of hyper-customizing. One of the most exciting things about working as an Illumia MD professional is that you have the tools to tailor-make each treatment to address your client's multifaceted skin types and skin conditions. As skincare and medical professionals, we know only too well that a patient rarely presents with just one skin concern in a consultation. The patient that arrives and says, "I just have open pores and I have no other concerns," is a rarity. Moreover, your clients will arrive and say, "I have open pores and some fine lines and some oiliness and some dry skin." And rather than trying to decide which of these areas you want to start with, you can hyper-focus your treatment so that you target each of these skin concerns in every treatment. Before we dive into how to hyper-customize your treatment with the Illumia MD products, let's first remind ourselves of the different skin types and skin conditions. In order to truly understand the different skin types, we first need to remind ourselves of the hydrolipidic barrier. This is our skin's natural barrier to the environment, made up of hydro and lipids, so hydration and oils in the skin. And when this water and oil is in equal measure, we have a really good, even balance and a good shield from the environment, and we have a normal skin. When you have more than one or not enough of the other, this is when we present as a skin type. For example, if you have too much oil, you'll present as an oily skin. If you have not enough oil, you'll present as a dry skin. If you have not enough hydration, you'll present as a dehydrated skin. Now, some people have not enough oil and not enough water, and this can mean that the barrier is compromised, and that would result in sensitive skin. You will sometimes find that patients will present healthy oil levels but low hydration levels, and this is known as a combination skin. The 4 skin concerns that we work with at Illumia MD include acne, which is the presentation of acne lesions that include blackheads and whiteheads; pigmentation, which is characterized by darker areas of skin, either large or small; rosacea, which is characterized by redness and flushing on the cheeks; and aging, most significantly noticed in the form of lines and wrinkles. Now, some skin types and some skin conditions will naturally marry, i.e. acne and oily skin are often associated together. Now let's explore some of the Illumia MD products and how they will correct these individual skin types or conditions. Every Illumia MD treatment would start with a cleanse with a purifying gel cleanser and the balancing solution to degrease the skin, which I have already performed for this client. This is a really good opportunity to assess if you may need to hyper-customize the treatment for this client based on the performance of the skin on the day. For example, if your client reacts sensitively or experiences sensation to the balancing solution, you may want to tone your treatment down to provide a more mild treatment to suit the sensitivity on the day. That could be due to dehydration in the skin or sensitivity, or even just the seasonal time of the year. The second part of the facial is a pre-treatment mask, and we have a selection at Illumia MD that will help to benefit different skin types and skin conditions. The first is the refining clay mask. This is a really beautiful mask indicated for patients with oily or acne-prone skin. This contains pineapple and papaya enzymes, which will help to exfoliate surface skin and cellular debris. It also contains burra clay, which is a China drying clay. This will draw oils and impurities out of the skin, meaning that the skin is in exceptional condition to receive a chemical peel. We also have the enzyme retexturing treatment, an enzyme-rich, powerhouse exfoliating pre-treatment mask. This contains pineapple and papaya enzymes, as well as honey and soy to hydrate the skin. This is an extremely brightening mask that will soften the skin, preparing for a chemical peel. The deep moisture mask is indicated for patients with dehydrated or dry skin. You might be tempted to turn a client away for a chemical peel if they're presenting with excessive dehydration, but you can use the deep moisture mask on its own to really infuse hydration into the surface layers of the skin, making your chemical peel as predictable as possible. In this dish, I've prepared a small portion of each 3 of these pre-treatment masks. I'm going to proceed to apply the mask that's appropriate for the area of my patient's skin that needs those specialised ingredients. I'm going to start with the refining clay mask on the forehead. This is the mask with the enzymes and the China drying clay to draw out impurities. It's commonly known that the T-zone in the face, which includes the forehead and nose, is prone to oiliness due to follicular density in this area. You'll see that I'm applying a very fine layer of the refining clay mask, and I'm doing this on purpose. The finer the layer you apply, the more drying this treatment will be. So a client with very or excessively oily skin will need only a very fine layer. If you wanted to make this even more exfoliating, you could mix this in a medicine cup with a small amount of the balancing solution to add even more AHA to the product. Using downward motions, I have applied to the forehead and then the nose. Because I can see a little bit of congestion around the chin and jawline, I'm going to continue to apply the refining clay mask to these areas. To assess dehydration in the cheeks and further along the jawline, I'm now going to use the enzyme retexturing treatment to begin exfoliation and to soften those dead skin cells and help to remove surface cellular debris. It's very important that you're very particular with your application of these pre-treatment masks as not to create a demarcation line. These masks can be very powerful in their ability to lighten and brighten the skin. So to avoid a firm line between nice skin and hydrated skin, we must be sure to feather the product out onto the jawline and up into other areas of the face to make sure that we don't leave our patient with a visible demarcation line. Again, I'm applying a very thin layer of this treatment mask. If I wanted to make this treatment slightly more hydrating, for example, the cheek area, which is prone to dehydration and sensitivity, I can mix the enzyme retexturing treatment with the deep moisture mask. Now you could do this in different proportions depending on how hydrating and exfoliating you wanted this treatment to be. If you wanted this treatment to be very exfoliating and a little bit hydrating, you could mix 4 parts enzyme retexturing treatment to 1 part deep moisture. If you wanted this treatment to be very hydrating and a little bit exfoliating, you could mix 4 parts deep moisture mask to 1 part enzyme retexturing treatment. So using my artist palette, I'm just going to mix and blend the 2 products together to make a really nice hydrating treatment for the cheek area. Because my focus in this area is hydration, I'm going to apply a slightly thicker layer. This will mean that the product won't dry so much on the skin and will continue to infuse hydration into the upper layers of the epidermis. With all treatments, it's incredibly important that you leave at least a 2 mm gap in between the patient's eyelashes and the application of the treatment mask, serum or peel. Again, I'm just going to feather this treatment slightly to make sure that we don't have a solid demarcation line. I'm also blending the different areas where I have patchworked the masks to make sure there's no definitive line between the different treatments. Once these treatment masks have been applied, we will leave this on the skin to work for up to 5 minutes before we remove with cool water and then proceed onto our chemical peel. Please make sure that you've come right out to the client's ear, slightly into the hairline so that you have treated the entire face, and do not forget to do underneath the nose. After 5 minutes, we will remove this mask and then proceed to hyper-customizing a chemical peel. I've now removed my patient's treatment masks, and I can see that she's experiencing a little bit of an erythemic response just across the top of the cheeks. This is a beautiful action in response to the treatment masks that we've done. The next stage is to perform a chemical peel. Now you have the choice between self-neutralizing peels and peels that need to be neutralized. Today I've selected peels that need to be neutralized, and I've decided, because of my client's combination skin, to use a combination of two different peels. Because my patient has a slightly oily T-zone, I'm going to use a 30% combination peel of 20% lactic acid, AHA, to really break down those superficial keratin bonds and exfoliate the epidermis, and 10% salicylic acid, which is lipophilic, meaning that it has the ability to penetrate into the hair follicle and break down excessive sebum. We always apply the masks and chemical peels in the same way around the face. We start on the forehead, proceed on to the jawline, then the nose and top lip, and then the cheeks, finishing last. However, because my client has an excessively oily T-zone, I have applied the combo peel with lactic acid and salicylic acid to the T-zone first, because this is the area that I want to be exfoliating for the longest. I'm now going to come to my 30% lactic acid peel, which will be really good for hydrating the skin and exfoliating, and apply this to the chin and jawline, and then eventually the cheeks. Now you can patchwork and combine between the self-neutralizing peels. You could also choose to do the self-neutralizing peel, but the one thing you wouldn't do is patchwork between the self-neutralizing and neutralizing peels. For example, you wouldn't do a combi peel 30% in one area and the glow peel in another area. Again, always making sure that there's a 2mm gap in between the eyelashes and the beginning of my treatment. I'm being very sure to come out to the edge of the face and underneath the jawline so there's no demarcation lines. This peel will stay on the skin for a maximum of 20 minutes depending on client sensitivity and skin type, after which I will neutralize with the neutralizing solution and remove thoroughly with cool water. Now my client's skin has had her chemical peel neutralized and thoroughly removed with cool water. We've brought down some of that erythemic response with cold compress on the skin. One way that you can further hyper-customize your patient's treatment to accelerate their cellular turnover is to add the retinol resurfacing serum as a finishing treatment. We have different strength retinols with Illumia MD. We have 0.25%, 0.5% and 1%. You can patchwork and cherry pick across these percentages to hyper-focus the different areas of the skin that would respond well and better to certain percentages. For example, I'm going to use the 1% on the forehead, and I'm going to use the 0.25 on the more sensitive cheek area. This can be massaged gently into the skin with very soft motion until you have seen complete absorption. This retinol will help to support the skin, stimulating new skin cells in response to the chemical peel. It will also help to boost collagen synthesis and accelerate anti-aging results for your patient. Now that we've explored how to hyper-customize your patient's treatment, the consultation is the most important part because it will help you to understand what areas of the skin will benefit from which ingredients. Really take note of the different areas of the skin that would respond best to these ingredients. Your facial diagnostics is the most important aspect of hyper-customizing your facial treatment. If the patient needs congestion control on the jawline area, focus the refining clay mask and detox clear in this area. If your client would like to focus on anti-aging on the eyes, really focus your vitamin A around the eye area. Make sure that you tailor-make your patient's treatment so that they get the results that they deserve on the day. Now that we have completed our peeling and exfoliation process. All Illumia MD treatments are finished with the brightening accelerator, recovery balm and a broad spectrum physical sunscreen to really help protect your patient's skin in the hours after a chemical peel. Thank you very much for listening. If you would like any further support in hyper-customizing your facial treatments, please do contact either your regional business development manager or your regional trainer who will be happy to support you in this area.